Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
Pruritus, or itch, remains one of the most common and challenging symptoms in dermatology. It spans a wide clinical spectrum, from idiopathic presentations to chronic inflammatory diseases, systemic associations, and even treatment-related eruptions in oncology and immunology. This month, we explore new insights into chronic pruritus, prurigo nodularis, and the evolving role of immunomodulatory therapies. Together, these studies reinforce that pruritus is often more than skin deep, requiring a multidisciplinary and systemic approach to care.
We begin with a comprehensive review by Akiska et al. Examining chronic pruritus of unknown origin. Chronic pruritus of unknown origin, CPUO, is a distressing condition characterized by persistent itch lasting over 6 weeks without an identifiable cause. The underlying mechanisms remain poorly understood, complicating diagnosis and treatment. This systematic review examines the diagnostic workup and therapeutic approaches for CPUO, evaluating the quality of treatment studies using the strength of recommendation taxonomy algorithm. A comprehensive literature search was conducted, and studies discussing pathogenesis, diagnostic strategies, or treatment were included. CPUO pathogenesis appears multifactorial, involving T helper 2 dysregulation, neurogenic factors, Janus kinase 1, gastrin-releasing peptide receptor, transient receptor potential vanilloid 4, metabolic alterations, and aging-related immune changes. Current diagnostic approaches emphasize exclusion of systemic, dermatologic, and neurologic causes. Treatment options include topical agents, calcineurin inhibitors, capsaicin, systemic immunomodulators, JAK inhibitors, dupilumab, nemolizumab, neuromodulators, gabapentin, pregabalin, and phototherapy. However, available treatment studies are of low quality, with few randomized controlled trials. Chronic pruritus of unknown origin remains a challenging condition with unclear pathophysiology and limited high-quality therapeutic evidence.
In another review, Lanx et al. Turned to prurigo nodularis, where chronic itch and the itch-scratch cycle drive significant morbidity. Prurigo nodularis, PN, is a chronic, intensely pruritic skin disorder characterized by hyperkeratotic nodules and a debilitating itch-scratch cycle. Conventional therapies have limited efficacy and safety issues, while biologics have recently emerged as a promising alternative. A systematic search of PubMed, Embase, and central databases was conducted on November 20th, 2023, to identify studies assessing treatments for PN. Primary outcomes were changes in pruritus and quality of life. Safety was evaluated by adverse event incidence. 128 studies met the inclusion criteria, of which 25 were included in the meta-analysis. In studies of dupilumab, treatment was associated with marked reductions in pruritus and significant improvement in quality of life. Phototherapy achieved complete responses in 23%, partial responses in 60%, and no response in 7%. Dupilumab offers consistent, clinically meaningful improvements in PN with a favorable safety profile, supporting its use as the preferred first-line treatment.
Shifting from therapeutics to procedural dermatology, Dubouf et al. Explore the molecular effects of ablative laser therapy. Ablative laser therapy is an interventional dermatological tool mainly used for removal of skin lesions, skin rejuvenation, and scar treatment. The biomolecular changes following laser therapy are yet not fully understood. This scoping review provides an overview of the molecular changes upon fractional ablative laser therapy. PubMed, Embase, and Web of Science were systematically searched, focusing on changes in gene and protein expression. In total, 20 studies were included, involving a variety of laser devices. Both fractional and full ablative laser induced a wound-healing response with dermal remodeling and neocollagenesis, characterized by an increase in metalloproteinases and collagen. The inflammatory phase was more pronounced after ablative laser compared to fractional therapy, with more pronounced expression of innate immune-related genes. High collagen type 1, 3, 7 protein levels persisted for 6 months following both full and fractional ablative laser. Old elastic fibers were degraded by laser therapy, followed by formation of new elastic fibers, as indicated by tropoelastin increase. Elastogenesis was more pronounced after full ablation. Interestingly, erbium YAG mini peels, Ablating the epidermis while preserving the basal membrane showed similar biomolecular changes compared to full ablation of the epidermis and superficial dermal layer.
Returning to prurigo nodularis, Waldman, Grinchbone et al. Provide important real-world data on comorbidities and healthcare utilization. Prurigo nodularis patients face a significant burden of comorbidities, necessitating a comprehensive approach to care. The authors aim to explore the association between prurigo nodularis, its comorbid conditions, and healthcare usage patterns. A population-based, cross-sectional study involved over 4,000 prurigo nodularis patients. Prurigo nodularis showed strong associations with various cutaneous and systemic comorbidities, mainly atopic dermatitis, chronic renal failure, and dialysis, as well as a myriad of mental health disorders. Prurigo nodularis patients exhibited increased healthcare utilization and medication claims. This study highlights the substantial comorbidity burden in prurigo nodularis patients, emphasizing the need for a holistic care approach. The study also underscores the importance of psychological screening and highlights the burden that prurigo nodularis and its associated disorders place on healthcare utilization. Future studies that include further research into prurigo nodularis pathogenesis and treatment strategies considering its systemic associations are warranted.
Next, Schellen et al. Evaluate targeted therapy in lupus, focusing on cutaneous outcomes with belimumab. The aim was to assess the long-term effect of belimumab on the cutaneous manifestations of patients with systemic lupus erythematosus, or SLE. The retrospective analysis included 29 patients with SLE. Cutaneous disease activity was assessed using the Cutaneous Lupus Erythematosus Disease Area and Severity Index, CLASI, and the revised CLASI activity scores before treatment with belimumab and at 3, 6, 12, and up to 60 months of treatment. 11 patients were treated for the whole observation period. However, only 8 patients were evaluable at 48 months and only 6 at 60 months due to loss of follow-up. Compared to the baseline score, a significant reduction of the disease activity score was seen during the treatment. The percentage of patients achieving a CLASI 100 response increased continuously over time, reaching a maximum of 30% after 60 months. Response was most remarkable among patients with acute or discoid cutaneous lupus. The treatment was well tolerated by the patients, with the most common adverse events being respiratory infections, headaches, and arthralgia, among others. This retrospective analysis demonstrated that belimumab has long-term benefits for cutaneous manifestations of patients with lupus erythematosus. However, prospective studies in larger patient populations are needed to confirm the findings.
A research paper by Antonyanzas et al. Investigates how carbon dioxide laser therapy may exert its therapeutic effects in Hailey-Hailey disease. Hailey-Hailey disease is a rare genodermatosis caused by mutations in the ATP2C1 gene that codes for SPCA1, a calcium transporter in the epidermis. To confirm the efficacy and safety of CO2 laser in Hailey-Hailey disease, the authors conducted a randomized, prospective, controlled study that included 10 patients with histologically confirmed Hailey-Hailey disease. A 4mm punch biopsy was taken from unaffected skin and the laser-treated area before and 6 months after treatment. Samples were used to extract RNA and analyze potential changes in gene expression. Laser treatment provided a significant reduction in the lesioned area. Gene expression analysis revealed reduced ATP2C1 expression in lesional skin and high expression of genes related to keratinocyte proliferation and interleukin-17 dependent inflammation. Interestingly, in affected skin after laser treatment, there was an enhancement of ATP2C1 with a reduced expression of genes related to keratinocyte proliferation and IL-17 dependent inflammation.
Turning to pigmentary disorders, Cristallo et al. Report real-world outcomes with a topical Janus kinase inhibitor in vitiligo. Vitiligo treatment has traditionally relied on narrowband ultraviolet B phototherapy combined with topical corticosteroids or calcineurin inhibitors, though these approaches offer only short-term relief with high relapse rates. Ruxolitinib, a Janus kinase inhibitor, works by blocking interferon gamma signaling to reduce immune-driven melanocyte destruction, and a real-world study of 50 adults with non-segmental vitiligo found that twice-daily application produced meaningful repigmentation within just 3 months, with over 40% of patients achieving at least 75% facial improvement and significant total vitiligo area scoring index reductions. The treatment was well tolerated with no severe adverse reactions, improve patients' quality of life, and perform consistently with prior phase 3 trials, though the authors note that larger, longer studies are needed to fully confirm its efficacy and long-term safety.
Finally, Calderola et al. Address an important safety question regarding Janus kinase inhibitors in alopecia areata. The European Medicines Agency's 2023 alert linking JAK inhibitors to venous thromboembolism risk was based primarily on tofacitinib data in rheumatoid arthritis patients, prompting this study to evaluate VTE risk factors and laboratory markers in 47 alopecia areata patients before and after 6 months of baricitinib treatment. No thrombotic events occurred during the study, no patients had baseline contraindications, and most laboratory VTE markers remained unchanged, with factor VIII levels actually declining significantly, suggesting a reduction in inflammatory thrombotic risk rather than an increase. The authors conclude that routine comprehensive thrombosis screening before starting baricitinib is unnecessary for most patients, reserving specialist consultation and targeted lab testing only for those with specific clinical risk factors, such as a personal or family history of clotting events.
This concludes the April highlights, focusing on advances in pruritus, inflammatory skin disease, and targeted therapeutics. From mechanistic insights to real-world evidence, these studies underscore the importance of integrating systemic thinking into dermatologic care. Thank you for listening. Until next time, stay informed and stay curious.